Steinable, and I'm recording my health assessment video for Maryville University's Advanced Health Assessment. This is my friend Jenny.
Hello.
She's agreed to be my patient today. And we came in, I had her empty her bladder, and then she took off as much clothing as she felt comfortable. I did offer her a gown, and she said she felt fine in her swimsuit top, and she's got some yoga pants on. So we're ready to begin. Yoga pants. So Jenny, we're just going to do a general physical assessment today. I'm Kate, I'm going to be the nurse practitioner. So if you have any questions, any concerns, anything hurts, or you just want me to take a break for a minute, let me know.
Okay.
Okay, we're going to start by doing some vital signs. First, I'm going to just feel your pulse. So we just make sure we have a nice regular rate and rhythm. We count it for about 30 seconds and double it, or 60 seconds, and then take that number. A good time to do their respiratory rate is while you still have your hand on their wrist, so that you just glance over, look at their chest, and you count a nice regular respiratory rate. If you tell a patient that you're going to count their breaths, they start to breathe faster, or they start to get very cognizant of their breathing. So this is a good way to do that. Now we're going to take your temperature. Okay. Open your mouth. This thermometer takes a while. Okay, 98.8. I'm going to take your blood pressure. Awesome. And just uncross your legs, please.
Okay.
It raises your blood pressure up if your legs are crossed. Give this a false reading. And just relax your arm. Great blood pressure. Thank you. 5/62. Makes sense because you're thin and active. Awesome. Okay, so now we're going to take your height and your weight.
Okay.
So if you want to take your shoes off, we'll come over here.
Okay.
So I'm going to have you stand against this wall.
This one?
Uh-huh. And we'll just grab.
Can we step on it?
Yeah. That'd be great. Yeah, you can just stand with your back against the wall. That's good. Okay, stand against the wall. Perfect. 64 inches.
5'4".
Yeah. Okay, now step on the scale, please. Get your shoes off.
Yes.
Perfect.
Do I wait for it?
Yeah, it's 0 now.
Okay.
And you don't have to show her weight on the video. Great. Now we'll come back over to the exam table.
Okay.
Be careful. And we're going to get started. So we're just going to start with your head. We always start with inspection. So we just start by looking, make sure that our head looks normocephalic. We don't see any areas of alopecia, any obvious bulges or masses or trauma. And then we'll start with palpation. We feel her skull bones. Feel just the shape and the contour of her head. See if there's any lesions that we weren't able to see. Jenny has really thick hair, so the inspection part we weren't really able to see very much. And we also just note the general texture of her hair, and that when we run our hands through, we don't pull out a big lump of it, that it stays in place. Everything looks great. Okay, so now we're just going to start with your face. We're going to look and make sure everything is symmetric. Your eyes are nice and symmetric. Your ears don't go below the level of your line, of your eyes. Your nose is nice and midline. Okay, so I'm going to have you do a couple things. Puff out your cheeks. Okay, show me your teeth. Now squeeze your eyes shut. Great, and wrinkle your forehead. Good. That tests cranial nerve 7, the facial nerve. Now we're going to move on to your eyes. Oh, actually, we're going to do a few other things. So I'm going to have you close your eyes and tell me when you feel me touch you.
No. 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 No.
Great. Now I'm going to have you close your eyes again and tell me if you feel it soft or if you feel the sharp end of the stick.
Soft. Sharp. Soft. Sharp.
Great. That is testing part of the trigeminal nerve. Now we'll test the other part. It's a sensory and a motor nerve. So the motor part is your jaw, so we feel your temporomandibular joint. So clench your jaw. Good. Now move it side to side. Good. And front and back. Good. We're feeling for any clicks or pops or any pain. And everything looks great. And now we're going to palpate your sinuses. The frontal sinuses and the maxillary. Good. Now we'll move on to your eyes. So let's try it. So now we're going to use our pen light. And I'm just going to inspect. We're going to start with inspections. I'm going to look at your eyes again, making sure your eyebrows are nice and full, your eyelashes go outward, there's no entropion or extropion. And now I'm going to have you, I'm going to lift your eyelid up and look down. Good. Use our pen light too. Just looking at your sclera, making sure it's nice and white. There's no objects. Look up. Perfect. Good. Now I'm going to look at your conjunctiva. It should be nice and pink, and it is. Okay. So now we're going to go through the 6 cardinal fields of gaze. So just keep your head still and only with your eyes follow the tip of my light. Okay, keep looking. Good. So there's no jumping. Her eyes are easily able to track the end of my pen light through the 6 cardinal fields of gaze. Now we're going to test your pupillary response. So we shine our light directly in one eye and observe for the constriction directly in that eye. Look straight ahead. We shine it again and we look at the other eye for the consensual response. So direct, consensual. Good. Now we're going to do the cover-uncover test. So if you just pick a point on the wall back there. Yeah. So stare at it and then cover your left eye. Keep staring at the point. Now uncover your eye. Good. Now keep staring and cover your right eye. Good. Now uncover. Good. So making sure that her eye doesn't wander when she's fixed on the point, and then we uncover. So by testing her eyes, we have done the optic nerve, so nerve 2, 3, 4, and 6. And all of those tracked really well. They were grossly intact. So now we can move on to your ears. And we always start by inspection. Let me get my otoscope real quick. All the things that I'm going to need. Start by looking at her ear. I don't know if you want to come to this side, Sean. That'd be good. Yeah, that's quite good. We start by inspection. We look at the placement on her head. Again, looking at its relation to her eyes. And then we start with palpation. Just palpate the auricle. Any pain?
No.
Okay. So we test for pain when we just gently pull. Now we're going to look at her tympanic membrane. And so as we insert the otoscope in, we're looking at the mucosa, making sure that it's not having any exudates, any erythema, there's no drainage, and then as we look for the amount of cerumen that she has, very scant. Then we're also going to look back at the tympanic membrane, making sure that it's nice and pearly gray. We can see the bony landmarks, and we don't see any distorted light reflex. Anything that would make us think that she might have an infection. So we're going to repeat that process over here. Good. Was there any pain when I pulled on that ear?
No.
Good. Okay. Now we're going to do the whisper test. So I'm going to have you just cover one ear and look straight ahead. And I'm going to whisper a word to you, and you just tell me what I said.
Okay. Purple.
Now cover this ear, and I'm going to whisper something else.
Orange.
Now we'll do the weather and the Renee test. So I'm going to strike this tuning fork, and I'm going to put it on the top of your head. You just let me know if you hear it in the left ear, the right ear, or both ears equally. Okay.
Both.
Good. Okay, now we're going to do, and that's a normal finding. And now we're going to do the Renee test. I might move on this side so that I can see a little better. So I'm going to strike the tuning fork, and I'm going to put it right back here on the mastoid bone, and then just say the word okay when you don't hear it anymore.
Okay.
Then I'm going to put it right here, say the word okay when you don't hear it anymore.
Okay. No. No.
That's normal. Air conduction should be about twice as long as the bone conduction was, which is a normal finding. So now that we've tested her ears, we've also tested the vestibulocochlear nerve, which is cranial nerve 8, and that was also grossly intact. So let's move on to her mouth. So we're going to just start with inspection. We're going to use our pen light, and we're just going to look at her lips. Jenny did have a piercing down here, so we make note of that. So open your mouth. Good. We look at her buccal mucosa. Can you lift your tongue up? Good. And each side. Awesome. We always want to have her lift up her tongue and look at each side because that's where a lot of oral cancers can hide. And we're just going to keep looking. Sorry. We look at her teeth, looking at the dentition, seeing if we see any obvious caries, any broken teeth, any missing teeth. And they're all in really good repair. Say, ah. Good. So we always make sure that the uvula rises symmetrically, which it does, and we note the anterior posterior pillars. Her tonsils are there. They're about a 1+. No erythema, no exudates, and her posterior pharynx is also without erythema or exudates. So now we're going to test your gag reflex in your mouth. Good. Good job. And now stick your tongue out and lift it up. Good. Now stick it out and put it down, side to side. Good. Now stick it in your cheek against my hand. Good. So testing the uvular response, her gag reflex, and also her tongue. That was the glossopharyngeal, the vagus, and the hypoglossal nerves. So that's 9, 10, and 12. Just working our way through those nerves. All right. So now we're going to move on. We're going to test your lymph nodes. I'm just going to check them all. So we're going to do your preauricular, your postauricular, anterior cervical chain. You can just wrap your neck. Posterior cervical chain, and the deep cervical. Just move your head from side, or yeah, like that. No, like looking. There you go. Side to side. Out of that side. Good. And as they move their head, the deep cervical are sometimes hard to feel. So as they move their head side to side, it kind of moves those muscles and separates them, and you're able to get in a little deeper. Now we're going to do your supraclavicular, your infraclavicular, and your axillary. Try not to tickle you. Good. Good. So now we're on to the neck. So we're just going to start with inspection, as always. Just put your head straight. There, it looks nice and midline. We'll go to palpation, and we check and see that it was midline. Check her thyroid. Take a swallow for me. Good. Swallow again. Good. Now we also always inspect and see if there's any jugular venous distension. Can you just turn your head from side to side? Good. Sometimes that helps you see if there's any jugular venous distension, which I don't see any. Now we're going to auscultate. So I have a cardiology stethoscope, so I know that we auscultate with the bell, but I only have one side. So you just press very lightly for the bell, and then you press more firmly when you want the diaphragm. So we're going to auscultate over your thyroid. So I'll Have you take a deep breath in and then hold it. Good. Good. Breathe. Now take another deep breath in, hold. Good. Take another deep breath in and hold. Good. So we're listening for any bruits, and we don't hear any, and the reason that we have her hold her breath is that you don't want to mistake the blowing of the air coming in or out with a bruit, because it kind of sounds like a blowing sound. So now we're going to palpate your carotids. We always palpate these individually. Otherwise, you could occlude too much blood to their head and they could get lightheaded and faint. We don't want that. That's good. All right. Now let's move on to your upper arms. We're going to also test spinal accessory nerve, cranial nerve number 11. So I'm going to have you shrug your shoulders up. Good. Now put them down. Now shrug it against resistance. Good job. Okay, so we'll just start with your upper extremities. We just look at their skin and make sure we're using inspection that if we see anything that's out of the norm. There's a tiny little mole here. And then we just always use our ABCs. If it's asymmetrical, the borders are regular, the color's not uniform, and the diameter is too big, and that one looks great. Everything looks good over here. Make sure to look at their shoulder as well. There's a little tiny mole right there. And we use our ABCs on that as well. Looks good. Great.
I have one back here too.
Yeah, you do. And another tiny one right there. Okay. Now we're going to do some passive range of motion. So I'm just going to move your arm in some different directions, okay? Just make sure that she can passively go through the full range of motion. Good. And now, against resistance, we're going to test your muscle strength. So try to push against my arm. Good. Now try to pull your arms back. Good. Let's pull you up the hip. Let's check your pulses. Your brachial and your radial. Good job. Now we're going to move on to your back. So you can either sit in a chair or you can just kind of flip around on the table. Whatever
You want me to lay down?
No, just turn around.
Oh, okay.
Perfect. So yeah, you can just sit cross-legged.
Cross-legged?
Yeah.
You need me to...
Yeah, just scoot back maybe just a little bit.
Can I do this?
Yeah, perfect. That's perfect. Okay, so now we always start with inspection again. That's the mole she was talking about. And Jenny's skin exam. She also has a tattoo on the back of her neck. I don't know if you can see that on the camera. Or you just put your hair up to the side. You don't have to hold it the whole time. Whatever's comfortable for you. Okay, so let's start with inspection. We just look at her back. We notice her rate and her rhythm of breathing. That it's nice and regular. She's not using any of her accessory muscles. She doesn't look like she's in any sort of distress. Now we're gonna percuss her costovertebral angle. Any pain?
Nope.
Good. And so now we move on to your back lung fields. So we're gonna palpate over. We just palpate all of your skin, making sure we don't feel any masses that we couldn't see. All right. Now we're gonna percuss. And we percuss our way down the lung field. Okay. Now we're going to move on. We're going to check your thoracic expansion. So we put our hands right about the 10th rib line. Take a big deep breath in. Good. And out. Good. So we just make sure that our hands rise equally. So one side isn't working harder than the other. There's no curvatures or anything like that. Now we're going to move on. I'm going to grab a pen real quick. Sorry, Jenny. Is it okay if I make a tiny mark?
Yeah.
On you? Okay. So we're going to check thoracic expansion. So what we do is we start out here, and I'm going to have you take a couple deep breaths in, and then I'm going to have you exhale totally and hold your breath, okay?
Okay.
Okay, so take a couple deep breaths in. Good. Now hold that air out. Okay, so now don't take a breath in. So we listen for where that sound changes. Make a tiny mark. The pen doesn't seem to want to make a mark. Let's grab. You can breathe.
Okay.
You're passing out on me. We'll grab a little highlighter. So we'll do that again. So take a big deep breath in and then let it all out. And don't take another breath in. Good. Right about the same spot that we were before. Okay. Good. Now breathe. Good. Now this time you're gonna, whenever you're ready, take a big deep breath in and hold it. Okay. So now we percuss down from that line that we had the first time. Make another mark. Okay, breathe. And we measure, we're just measuring your diaphragmatic excursion, and that should be between 3 and 5 centimeters, which yours is. I know it's probably hard to see the highlighter on the camera. Okay, so we're going to do the other side. So, same thing, take a couple breaths. And now let it all out. Okay, breathe. Always important to let your patient breathe in between when you're doing things. Now take a couple breaths, and we're going to take a big deep breath in and hold it. Good. Good. Now we'll measure this side too. Okay, you can breathe. Good. And we also measure to see if they're equal on each side. Sometimes the right side is up a little bit because of the liver. Jenny's is nice and even. So now we're going to move on to auscultation. Oh, we're going to do one more thing first. We're going to do tactile fremitus. So every time you feel my hands touch you, say 99.
Okay.
Okay.
99. 99. 99.
Good. Now again.
99. 99. 99. 99.
Good. Now we'll do auscultation. So we just move systematically over her posterior lung fields. Take a deep breath. Good. Just breathe in and out. I'm going to have you lift your arms up over your head, and we're going to do your lateral lung fields. By lifting your arms up, we expose a little bit more of that lung space. So we start with percussion, and now we're going to auscultate real quick. We always compare each side, just as we do. Good, you can put your arms down. All right, now we'll flip back around. We're going to do your anterior chest. So again, we always start with inspection. We're just noticing the way that she's breathing, if she's pulling any with her accessory muscles, which she isn't. We're going to just do some light palpation just to see if there's any obvious masses that we haven't been able to see already. And now we're going to percuss. Sorry, I want to make sure that. Now we're going to auscultate your anterior lung fields. Good. All right, all those sound clear. There's no adventitious sounds in her lung field. So now we're going to go to the cardiac portion. So we're going to start with just looking, seeing if we see any like very outward pulsations, and we don't. So now we're going to start with palpation. We feel at the precordium for any 3 thrills, heaves, or lifts. And then also down here at the point of maximal impulse. Good. Now we're going to move on to auscultation. So we're going to go through the aortic, and we'll press lightly for the bell and then press more firmly for the diaphragm, so we listen with both. And that's on the right sternal side at about the second intercostal space. Now we move over to the left side. And that's the pulmonic, the Erb's point, tricuspid, and the mitral is down here at about the fifth intercostal space, midclavicular line. Great. And now I'm going to move all this stuff down. And we're going to start with your abdominal assessment. So if you just feel comfortable laying down, I'm going to have you lay this way. Actually, could you turn around?
What does that mean? Like back, like on the
Yeah.
belly?
No. Put your legs down on this side.
Oh,
Perfect. So I'm going to palpate your liver, and it'll be easier if you're on this side. Good. So we get down on the level of the abdomen. We can use some tangential lighting. And we just note for the contour and the general shape of her belly. We're trying to see if we see any pulsations. All right. So now, always with bowel sounds, we skip the palpation and the percussion before the auscultation because we want to hear what her bowel sounds really sound like before we get them all messed up. So we, in each of the 4 quadrants, do nice active bowel sounds. You can listen in each quadrant for up to 5 minutes if the bowel sounds are hypoactive. And while I have my stethoscope out, we'll just listen to her aorta. And then where the renal arteries split off from the aorta on both sides. The iliacs on each side. And the femoral. So now we'll move on to palpation, and we'll just use light palpation at first. And part of it is just to kind of get a feel for what we're feeling for. It's also to get the patient just used to our touch and just relax those tummy muscles. And now we'll move on to deep palpation. Make sure we don't feel any masses. Good. Now we can move on to percussion. And we should hear that nice timpani. There's your liver border. Sometimes if a patient has a full bladder, you can also percuss their full bladder. Try to percuss the spleen. The spleen hides up in under the ribs. Sometimes you can't percuss it. Sorry. It sounds like I did percuss. A little bit of dullness right there about the 9th rib. So now we're also going to percuss for your liver borders. We're going to grab our highlighter again. So starting at about the umbilicus. You're fine. We percuss up. So just like before, we hear that sound change, and then we percuss down, always in the intercostal spaces. And that should be about 6 to 12 centimeters. We'll grab our little handy dandy thing, and yeah, it is between 6 and 12 centimeters. Okay, so now I'm going to attempt to palpate your liver. So what we do, I don't know if you want to stand on this side, it might be better. we're going to use the hooking technique. So I'm just going to hook my fingers up under that costovertebral angle, or the costal margin, sorry. And take a big deep breath in. And out. Good. And as you feel her taking a big deep breath in, the diaphragm will kind of move that liver down, and you'll feel the edges slip between your fingers. And it should feel nice and smooth. We'll try to palpate her spleen. But that is not a normal finding to be able to palpate the spleen. It would mean that it was enlarged. And it again is kind of up here under the costal margin. And now we'll raise up her flank and we'll try to palpate the left kidney. Good. Sometimes the kidneys are not palpable. We use this capture technique over here. The right kidney is easier to palpate just because anatomically. Sometimes you can feel it slip between your fingers. Okay. We're also going to palpate for your aorta, your aortic pulsations. Good. And just test the width. Good. Now if you just kind of want to do like a half sit up, there we go. So we just look, our stomach muscles are nice and even. We don't see any bulges or any hernias coming out. You can sit all the way up now. Perfect. If it's okay with you, I'm just going to kind of move these pants up. Or you can do it. Awesome. That's good. We'll do the other side too. Just so we can see your lower extremities. We can see your muscle mass pretty well through that. So we just look. We use inspection. Like most women in America, Jenny shaves her legs, so we would also look for hair distribution. Bless you.
I'm so sorry.
You're fine. Bless you. You're fine. So we look at her legs. We look for any edema. Don't see any. We're going to just palpate for temperature. Good. We'll also palpate her pulses, the popliteal. Posterior tibial, and the dorsus pedalis. Good. Now I'll test your muscle strength. So try to push your legs against me. Good. Pull them back. Good. Okay. So we already got a little bit into the neurological exam. We already did most of the cranial nerves. The one that we didn't do, which isn't normally done in clinical practice, is cranial nerve 1, which is the olfactory. But for the video, we will do it. So I'm going to have you close your eyes, and then I cover one nostril.
Cover one?
Yeah, just like occlude one. And then smell, and tell me what you smell.
Vanilla.
Good. And now cover your other nostril. Good. And tell me what you smell.
Cinnamon.
Good. And then, we didn't do this earlier, so I'll just occlude one nostril, take a deep breath in. Good. Take another deep breath in. Good. Alright, now, so those are all of the cranial nerves. We did the olfactory nerve right now. We did 2, 3, 4, and 6 when we checked her eyes. We checked 5 when we had her puff out her cheeks. And do all, oh no, we checked 5 when we had her do her temporomandibular joint and the ability to feel the sensation on her face. We did 7, the facial, when you puffed out your cheeks and you showed me your teeth and you did all that. 8, the vestibular cochlear, and your hearing is intact. 9 and 10 and 12 all have to do with your tongue and your uvular rise and your gag reflex. And then 11 was that spinal accessory. We had you shrug your shoulders. So that's great. So let's do some reflexes. So just relax your arm. The key to reflexes is to have your arm really relaxed. Good. Relax. Good. Checking that brachial. Okay. Now we'll do your popliteal. Good. Good. Got good reflexes. Now the Achilles is hard to do, so what I'm going to have you do is actually just lean with one knee on his chair, and that just ensures that your leg is totally relaxed. Good. And you see her foot jerk. Good. Have you pop up there for just a second. We'll go on to your muscle strength. We've already done a lot of your muscle strength. We tested your arms, but what kind of, yeah, you can pull those down, sorry. We'll test your muscle strength a little bit more, so hold your arms out to the side. Now try, don't let me push down. Don't let me push up. Good. Hold them out like this. Don't let me pull down. Don't let me push you back. Okay. And then with your legs again, don't let me pull you up. Good. Don't let me push you back. Good. Now we'll try to lift your legs up. There you go. Good. So that's looking great. Now I am a liar. We're going to put this up just a little bit more. We're going to see if you can tell that soft or sharp down here, okay?
Okay. Soft. Sharp. Soft. Sharp.
Good. All right, so stand up. We're just going to look at your vertebral column. Just turn around for me. Awesome. We just look. Just palpate down and make sure that everything is good. And then just lean over and just hang your arms down. Good. So we're just making sure that everything is nice and straight. And it is. There's no scoliosis or kyphosis. Okay, you can come up. All right. And that you can turn around. That concludes my health assessment of my friend Jenny. And again, this is Kate Steinable for Health Assessment at Varianville University. Thank you.